scalpel and a tray here for the moment, but if you look at the rest of your equipment, you can see that you have forceps. These aren't tweezers, they're forceps. Notice the teeth at the end. We have two different size forceps. Both have teeth. We have macro tooth, which are the larger ones, and micro tooth tissue forceps. Because we're working with small animals, rats and mud puppies, you probably won't have any real use for the macro tooth tissue forceps. Maybe when we get to sharks and you're skinning the shark, that is probably the only time you'll use the larger of the two sets of forceps. For today, working with the chicken thigh, you'll use the micro tooth tissue forceps. We also have a pair of scissors here. And I'm going to show you how to hold the scissors properly. You don't hold them like you did in kindergarten when you're making little snow angels and things like that. So what you will do is put your thumb in the ring like you did in kindergarten, but your ring finger goes in the ring. So your index and middle finger are not involved. Then you're going to drop the scissors so the weight is resting on your middle finger, and your index finger is right where the two blades meet, where that screw is. And this gives you a more precise grip on the scissors for guiding it into objects. And you think about the size of the animals we're working with. Working with these scissors on an animal like a rat is like doing an appendectomy with a hedge trimmer. It's much larger than you're thinking compared to yourself. So we want to be very careful to make sure we're not shaking when we go into the specimen. And so by holding it like this, you've got much better precision. Some of you will probably not be comfortable holding it like this. So another way of doing this is thumb, middle finger, rest the weight on the index finger, if you're more comfortable with that. Most of the time, we're not going to use the scissors until we get out of muscles, but when you're using scissors, it's the separating technique. So imagine my middle finger's an artery and my index finger's a vein, and we want to separate them. You're going to stick the scissors in closed, and then open. Close them, withdraw, move up, open. And that will allow you to break apart the collagen bundles that anchor blood vessels onto each other. It also helps you break away fat without losing the structures by just chopping through the fat, as we'll see when we get into that. But most of our work will involve our scalpel. So the first thing we want to look at is the scalpel handle and the blade. So here's your handle. It's a number 3 handle. There are different types of handles, and it's metal, which is great because, again, we don't want any wiggling when we go into the cutting portion, all right? Plastic scalpel handles are great for like Bio2 lab, but for the kind of precision we're doing, they're not really what we want to work with. You'll notice we have a groove portion here. This roughened area is actually where your fingers are going to go. And then you'll notice this portion here, which is the receptacle. And you'll notice that where the receptacle meets the body of the handle, there's an angle here. That angle is going to match up with an angle on the blade. So here's our blade. It's in the foil containers, and so foil wrappers, I should say. So a lot of times when you look at the foil wrapper, you can grab hold of these two flaps and just pull it apart. If that's not working for you, you can just push it out of the bag like so. Pulling it out like that. But if we take a look at the blade, it's shaped kind of like a hunting knife, where it's curved on one side, coming to a point. But we have another side that's dull, including the back end of the blade. So I know this sounds really obvious, but always handle the blade by the non-cutting surfaces. Now, right now, you're nervous. You're afraid you're going to cut yourself. And so you're going to be much more careful and less likely to cut yourself. But later on today, when you go to put your blade away, when you go to throw it out, your hands are going to be slick with chicken fat, and you could slip and cut yourself. So you do want to be careful about that. All right, so another thing we see as we look at the blade, there's an angle here. And that angle should match up with this angle here. So when you put the blade on, it fits on there properly. And then we've got this hole here, and that's where the receptacle goes into. In fact, if you look at the receptacle on the side, you'll see a groove there, which will allow the blade to become locked onto the handle. All right, so putting the blade on. Very carefully, again, notice I'm not handling it by the cutting portion. I know that sounds obvious, but you gotta be careful. These are very, very sharp blades. These are carbon steel blades. The only thing you've come across that may be similar to it would be razor blades. I mean, this is actually sharper than a samurai sword. So you wanna be careful. Slide your receptacle into the hole, like so, and just slide it forward until it locks in place. That's it. Now, once you go ahead and do that, I'm gonna come by and make sure that you're doing it right. If you're not comfortable, let me know and I'll just do it in front of you with yours so you can see.